Hi, hello friends, good morning to everyone. Welcome to our channel, The Voice of Nurse. We are going to discuss a new topic from the nursing point of view. Topic name is Hospital Acquired Infection, HAI. Hospital acquired infection or hospital acquired infection, also called as nosocomial infection. Nosocomial infection means hospital acquired infection, nothing but. Today's class, what we are going to discuss, we will see first index, introduction related to the hospital acquired infection, definition, causes, types of nosocomial infection or HAI, most common infections. What are the infections will comes under the nosocomial infection, signs of infection, and also we will can see here along with symptoms. Next, mode of transmission. What is the transmission modes? And chain of infection, preventive measures of hospital acquired infection, and what is the nurse's role in the nosocomial infection and or hospital acquired infection. What is the nurse's role and responsibilities, and what are the preventive measures we are going to see in the today's class. Till now what we finished, we will see briefly. According to the subject wise, we finished almost 2000, more than 2000 MCQs. More than 2000 MCQs according to the subject wise we already finished. Each and every subject we finished 100 very important FAQs. According to the subject means nursing point of view, we discuss related to the anatomy and physiology point of view, nutrition, fundamentals of nursing, first aid, sociology, medical surgical nursing, child health nursing, microbiology, nursing foundation, and also we discuss related to the community health nursing, nursing research and management. These many subjects we discussed in previously, and along with these subjects we discussed 5 sets of model papers, 4 sets of model papers, and 1 set of mock test. TS MHSRB released mock test also we discussed, and also 3 sets of NHM 2022 2 sets, 2022 2 sets of NHM, and 1 set of 2023 January exam paper also we discussed previously. In last class we discussed related to the immunization also, very important topic. Revised immunization schedule also we discussed. Recently we discussed related to the very important topics. Along with these subjects plus 100 topics part 1, in part 1 50 topics, very important topics, and in part 2 another 50 topics. Totally we discussed related to the very important topics in the nursing point of view. Totally 100 topics we already discussed. Please read total subjects related to the nursing point of view, and these 100 very important topics along with these 100 topics, and please read MCQs also. Today we are going to discuss hospital acquired infection or nosocomial infection. But before moving on to topic, a small request friends, anybody here new to this channel, subscribe my channel, click on the bell icon for further notification, and please share the video to your friends. Class is useful to anyone. Please give a like and share your opinion in comment section. And let's move on to today's class, hospital acquired infection or also called as nosocomial infection. Today we are going to discuss introduction, definition, causes, types, most common infection, signs of infection, and mode of transmission, chain of infection, preventive measures, and role of nurse in hospital acquired infection. We will discuss introduction first. Nosocomial infection, also referred to as healthcare associated infections, means HAI. Healthcare associated infections are acquired during the process of receiving healthcare that was not presented during a time of the admission. Nosocomial infection, also referred as a healthcare associated infection. Already I said hospital acquired infection is also called as nosocomial infection. Are acquired during the process of receiving healthcare. that was not present during the admission time after the admission of 48 hours. Approximately the period of after the admission of 48 hours, any symptoms related to the infection is called as nosocomial infection. Infection developing in the patient after the admission to the hospital which was neither present or in the incubation period at the time of hospitalization. They may be became evident during the patient's stay or after their discharge. Hospital acquired infection, also called as hospital associated infection, and also healthcare associated infections. Nosocomial infection, also called as healthcare associated or hospital acquired infections, or subset of infectious diseases acquired in a healthcare settings only. During the hospital setup, during while taking care only, the nosocomial infection will happen. During the healthcare settings or in the healthcare settings only, nosocomial infection will occur. Nosocomial means, in shortly I will say, originating or taking place in a hospital, acquiring in a hospital, especially in reference to an infection. Nothing but in the hospital itself somebody will get a infection, means this is called as nosocomial infection. Next we will see the definition. Definition of nosocomial infection. Nosocomial infections happen when these germs make to sick within the 48 hours after the hospital admission is called as nosocomial infection. During the period means within the 48 hours of after admission is called as. Any symptoms happen in the within admission of 48 hours period is called as hospital acquired infection or nosocomial infection. Nosocomial infections are infections that develop while a person is receiving the medical attention. Nosocomial infection, they will means the person or any client will develop a nosocomial infection during the receiving of medical attention or medical care in the hospital. For example, pneumonia, urinary tract infections, and GI, gastrointestinal infections, and etc. These all things comes under the nosocomial infection due to the any surgical or any medical treatment during the situation. They will develop 40 hours of the admission. After 48 hours of the admission period is called as nosocomial infection. There is no infection, patient is normal, means client not developed any nosocomial infections or hospital acquired infections. We will see the causes. Nosocomial infections are caused by multi drug resistant pathogens acquired via invasive procedures, excessive or improper use of antibiotics, not following infection control and preventive measures. Nosocomial infections are caused by the multi-drug resistant pathogens acquired via the invasive procedures. Invasive procedures means, for example, HD sheath placement, otherwise CVC line placement. Any invasive procedures can make the nosocomial infection. And also excessive or improper use of antibiotics also one of the cause. And also especially not following the infection control or preventive measures, means not doing hand washing techniques or not following the hand washing techniques and not using the PPE also. Next we will see the most common nosocomial infection. What are the most common nosocomial infections we will see now. Some of the common nosocomial infections are urinary tract infections, respiratory pneumonia, surgical site wound infections, bacteremia, GI and skin infections, gastrointestinal and skin infections, and also ventilator associated pneumonia, central and associated pneumonia, and etc. Means here the sum of the common nosocomial infection like UTI, respiratory pneumonia, surgical site, SSI, surgical site infection also. SSI means surgical site infection, but also surgical site wound infections, bacteremia, and also GI and skin infections, and CLAPSI, QARTI, SSI, VAP. These all are the 4 common nosocomial infections. SSI means surgical site infection. CLAPSI means central line associated bloodstream infections, and CAR-T means catheter associated urinary tract infection, and also VAP means ventilator associated pneumonia. These are the most common nosocomial infections. Next we will see the signs of infection. 5 common signs and symptoms of variety of infectious diseases like fever, diarrhea, fatigue, coughing, and these are the 5 common signs and symptoms of variety of infectious disease. And also the common infectious symptoms includes additionally chills, altered mental status, productive cough, shortness of breath SOB, palpitation, abdominal pain, flank pain, suprapubic pain, and also polyuria, dysuria, and diarrhea. Vital signs can reflect signs of systemic inflammatory response or sepsis. So these all are the common signs and symptoms for the nosocomial infection. So we will see the what are the mode of transmission. Mode of transmission of nosocomial infection. 4 principal methods of bone transfer. We are having 4 principal methods of bone transfer means the mode of transmission we are having in 4 methods. We will see one by one. Direct contact. First one is direct contact, second one is droplets, third one is vector borne, fourth one is a vehicle borne or also called as airborne. And also these viruses are readily transmitted the following close contact with infected respiratory secretions and formats like RSV. They are transmitted by contaminated hands carrying the virus to the mucous membranes of the nose or eyes. Nothing but droplet and direct contact with the clients or infected person. The most important and frequent mode of transmission of nosocomial infection is by direct contact only. Contact with most common routine of transmission is direct contact, and also hands or clothing surrounding areas and infected person's hands on clothes, hands of staff, important vehicles of spread, and contact of hands and clothing of attendants. For example, Staphylococcus aureus and Staphylococcus pyrogens. These all are the example. Both are the example for the mode of transmission of bacteria or viruses one person to another person. The exogenous transmission occurs due to the person to person interactions and through the environmental cross contamination. A direct contamination or direct transmission route of infectious agent present within the patient's body through skin contact or mucous membrane in human to human transmission. Next we will see the chain of transmission. What is the chain of infection and chain of transmission of infection? 6 links included in the chain of infection: the infectious agent reservoir, portal exit, mode of transmission, portal of entry, and susceptible host. The links in the chain of infection includes: first one is infectious agent, then reservoir and portal of exit, then mode of transmission, portal of entry, then susceptible host. Infectious agent microorganisms such as bacteria, viruses, fungi or parasites that can cause the infectious diseases. Most specifically, transmission occurs when the agent leaves its reservoir or host through the portal exit, is conveyed by some mode of transmission, and enters through an appropriate portal of entry to infect a susceptible host. This sequence is sometimes called as chain of infection. The way to stop germs from spreading is by interrupting the chain at the any link. If we are interrupting from the any link here in these 6 links, means in the infectious agent, reservoir, portal exit, mode of transmission, portal of entry, and susceptible host. If we are interrupting the chain link, means automatically we can reduce the chain of infection, means we can reduce the chain of infection, and the host is any carrier of infection or someone at risk of infection. This is related to the chain of infection. 6 links included in the chain of infection. Next we will discuss related to the what are the preventive measures. What are the preventive measures are present in the nosocomial infection? Preventive measures of nosocomial infection includes proper use of PPE, personal protective equipments. Example, gloves, mask, gown, cap, goggles. These all things comes under the personal protective equipments. And aseptic techniques, while using the aseptic techniques. And hand hygiene. Hand hygiene we have to maintain through the hand washing, proper hand washing, person to person, client to client, or after finishing and before touching the patient or after touching the patient. And if you are caring about a patient and we have move on to client B, means we have to wash our hands in between the clients interactions. Then environmental infection control measures. Environmental infection control measures means not only client before touching and after touching. Before touching the patient surroundings areas, before touching the patient, before touching the patient equipments and anything else, we have to wash our hands. We have to protect ourselves and we have to give a right to the client. The prevention of infection is right, one of the right of the patient, because we have to prevent infection through the hand hygiene and hand washing. These all are primary methods to protect the patient from transmission of microorganism one patient to another patient. Nothing but we have to reduce, we have to do a primary method. These all are the primary methods to protect a infection or mode of transmission to person to reduce the chain of infection. And also hand hygiene, also already discussed respiratory hygiene here. Respiratory hygiene means if client is having any related to the cough, sneezing and any related to the respiratory infection. One patient, A patient is having respiratory infection and B patient is normally admitted in hospital without any infection. The infection prevention measures to decrease the transmission of respiratory illnesses, for example influenza and cold viruses. A respiratory infection is spread when a person who is infected with a virus cough or sneeze. These other things comes under the respiratory illnesses. We have to maintain respiratory hygiene. How we have to maintain means, for example, if turning away from others, if coughing or sneezing, we have to turn away. Covering the nose and mouth or mouth with the tissue or sleeve. This is the one of the technique in the respiratory hygiene. And using disposable tissues. Disposing of used tissues in nearest the bin rather than storing in the pocket. These all are the respiratory hygiene methods. Sterilizing of particular items. Sterilizing the particular items means, if example for this sterilization of particular items means, for example sputum cough. If client is have any cough or any sputum, they want to spit out, means they need a one equipment from the particular items, means the particular items we have to sterilize before giving to the client. We will see the role of nurse in the nosocomial infection. According to Salim 2019, nurses play a crucial role in the preventing and controlling transmission of the infection through the application of standard precautions and maintenance of the healthcare environment. Nurses are play crucial role in the preventing of infection and controlling transmission of the infection through the application of standard precautions, means just now we already discussed related to the PPE and also hand hygiene and respiratory hygiene. These all things comes under the preventive measures. The nurse have to follow the all standard precautions and maintenance of healthcare environment. Good environment will give good health. That's why we have to maintain healthcare environment, good maintenance and standard precautions in the hospital setup. Use a standards precautions means in an environment surrounded by the various diseases and pathogens, nurses must protect themselves through the use of personal protective equipments, for example fluid resistant cover gowns, disposable gloves, mask and eye protection. These all are the standard precautions to transmit the infection or mode of transmission we can control or we can stop the chain of transmission also. Through using of standard precautions we can stop the chain of transmission or mode of transmission. Next we will see the standard precautions in the role of nurse in the nosocomial infection, and use the standard precautions means hand hygiene, PPE, safe management of care equipment, safe management of blood and body fluids, developing quality assurance procedures, providing expert care from birth to end of life. Nurses' role range from the direct patient care and case management to establishing nursing practices standards, developing quality assurance procedures, directing complex nursing care system is the most important in the nursing care. So here the nurse had to provide a particular standard precautions to the client. The nosocomial infection most commonly occur in the some conditions means in the invasive procedures and surgical interventions. During the surgical procedures the nosocomial infection will happen, means for example SSI, surgical site infection, or clepsy, QWERTY. These all things we have to maintain hand hygiene and PPE, personal protective equipment while using. We are using means automatically we can reduce the cases of nosocomial infection and we can reduce the cases also. The role of the infection prevention and control team is to promote best infection control practices in order to ensure the delivery of quality services for patient, visitors and staff. These all are included in the primary methods to protect the patient from the transmission of microorganism, one person to another person or one client to another client, and also visitors in the hospital and also staff. Make a set of flashcards that list defines the 6 roles of nurses must play in patient care: caregiver, decision maker, communicator, manager of care, patient advocate and teacher. These all things comes under the 6 roles of nursing. If we are following the hand hygiene most important measure prevent to infection among the patient and also others means hand hygiene. Respiratory hygiene also very important, and safe injection practices, sterilization and disinfection of patient care items and devices, environmental infection prevention and control methods also. The nurse have to follow these many things while taking care of the client to reduce the infections and promote the health care, promote the care and promote the recovery to the client. We have to follow these many rules and regulations, and these things related to the role of nurse in the controlling of nosocomial infection. This is related to the hospital acquired infection or nosocomial infection. Briefly we discussed related to the hospital acquired infection: introduction, definition, causes, types, most common infections, signs of infection, and also mode of transmission, chain of infection, preventive measures, nurse role in hospital acquired infection. So thank you for watching the video. Anybody here new to this channel, please subscribe my channel, click on the bell icon for further notification, and please share the video to your friends. Each and every topic is very important. While watching the video, the class is useful to anyone, please give a like and share your opinion in comment section. Thank you so much for watching, and keep watching friends. Stay tuned. Thank you.